Hello, my name is Jennifer Alton. I am a BSN student at Gardner-Webb University, and I'd like to talk to you this evening about early heart attack care. This is something that has become important to me since our hospital recently went through its chest pain certification. We did receive our certification as a chest pain center, and one of the things that the surveyor that was with us stressed was that um, we needed to go out into the community and talk to people about um, heart attack care and what they should do and how to recognize the signs. There is a program called EHAC, which is Early Heart Attack Care, that I want to bring out some of the main focuses of that campaign and help you realize what needs to be done when you have some symptoms that you may worry about that may be a heart attack. Well, I think what people don't realize is that symptoms of a heart attack can start well beyond that 30 minutes of pain that you have before you come to the hospital. There are symptoms that begin hours and even days before a heart attack happens that are there to kind of gently uh, tell us that there's something going on. But since they're not those classic, chest clutching, heart pain, left arm hurting signs and symptoms, we tend sometimes to overlook them. So one of the most important things for men and women is to know that heart attack symptoms start early. Every heart attack has a beginning, and you need to be uh, open and attuned to what your body is trying to tell you. Some of the symptoms that can present hours to days before a heart attack that um, people tend to ignore because of one reason or another. Either, um, oh, I've got a little burn in here, it's heartburn, let me take something, it'll go away. Or, I've never had a heart attack, I'm in good health, I exercise, I'll just um, blow that off, it's not really that important right now, are some of the main barriers that we need to get beyond so people realize how important these signs and symptoms are. Some of the symptoms that may come in this time period are, by some people's definition, very vague, so you need to be extra sensitive to them. It may be just a generalized weakness. It can be um, indigestion. It can be just fatigue, tiredness, a abdominal pain, a lower back pain, um, pain that goes down either arm, jaw pain, which is more classic to heart attack symptoms that people are used to, um, nausea, a cold sweat. These are some of the things that um, people need to be alert to and not just dismiss as a daily ailment. I know that every time you have an ache or pain like this, the first thing you need not think about is a heart attack. That's not even what I'm trying to get you to do. I just want you to listen to your body. Pain and discomfort is there for a reason. Um, People, think pain is this horrible thing, but it's our body's way of telling us that something's happening. Something is going on that we need to be more attuned to. So listen to what your body is trying to tell you when you are making excuses for the things that you feel. Women especially need to be very attuned to what their body's telling them. Women have different symptoms, as do diabetics, than the normal person that does not have diabetes. Women symptoms are a little more vague, and what I tell people is women that come into the emergency department that are I don't know, over the age of 30, if anything hurts from their abdomen up, they're going to get a cardiac workup that rules out their heart. They may have just a vague weakness. They may have a little dizziness. They may be anxious. Women experience different and less intense symptoms than men do, and that's something that we just need to keep in the back of our mind when we're talking about this. So let's talk about risk factors. There are risk factors that you can control and you cannot control. Risk factors that you cannot control. Say your family has a long history of early cardiac disease. People have heart attacks early. They have high cholesterol. These are usually something that you cannot, as an individual, control. However, you can make a difference in what the values mean to you. If you know you have a family history, you need to be very watchful of your diet. You can't be dismissive in what you eat. You have to watch what you eat at every meal. You have to concentrate on how am I preparing things. Everything can't be fried. Everything that is cooked can't be cooked with fats and oils. Things need to be baked. Things need to be prepared with healthy oils. Olive oil, coconut oil is a good, healthy way to prepare things rather than just butter and lard. Stress can affect you if you have a cardiac issue. Smoking, whether you smoke or not, that's definitely a choice that we can make. Obesity, if you are either a little or severely overweight, people that hold extra weight around their abdomen are more likely to have heart disease and or diabetes. Diabetes is also a risk factor for heart disease. So if you have these things, you need to be mindful of your diet and your exercise. Being sedentary, you cannot sit in an office in a chair for 6 to 8 hours all day and then go home and sit on the couch. You have to have at least 30 minutes of exercise 3 to 4 times a week to be considered not sedentary, and your body and your heart will thank you for it. Diabetes is always something that also affects cardiac disease. So what do I do? What do I do if I think myself, a family member, a neighbor is having cardiac chest pain? One of the best things that you can do is give them an aspirin. If you have, they don't call them baby aspirin anymore, they call them low dose 81 milligram aspirin. Anyone that is having a cardiac event, we give them 4 low dose aspirin, chew and swallow. The only reason we don't give them is if they have a documented anaphylactic reaction. If they say, well, that hurts my stomach, that makes my tummy hurt, you know, you have to do the benefits outweigh the risk, and we're going to give them the aspirin anyway. When you call 911, which is what you should do immediately, they're going to ask you, do you have an aspirin? Have you taken an aspirin today? And then EMS is going to ask you the same thing. Have you taken an aspirin? So an aspirin is very important. It helps slow down the blood clotting process that is causing that heart attack. People think that they can call EMS and it's going to take them longer to get to the hospital. It may take them longer for EMS to get there, load them up, and take them to the hospital than if they drove on their own. But when EMS gets there, they have certain pieces of equipment, they have the knowledge, they have medications that they can start your treatment as soon as they get to you. They can gather information to turn over to the hospital staff when you reach the hospital. So do call EMS. It is the right thing to do. They're going to be there and care for you immediately when they walk in your house, or if you're pulled over to the side of the road when they walk up to your car. It's a safe way to get to the hospital. You're not going to pass out or have an event driving. You're going to be safe with them in the back of an ambulance. I know it's sometimes uncomfortable for people to think about driving in an ambulance, but they're there for a reason. So I have made it a promise to you know, my community that I'm going to go out and educate people on early heart attack care. Heart attacks have a beginning. They begin sometimes, like I said, hours or days before that all too stressful event that you end up in the hospitals. And if you know how to react to this event, and you know what to do and what not to do, you're going to be able to maybe save your life, maybe save the life of a family member or a friend or someone that you go to church with. So it's very important to get out, educate yourself, and thank you for allowing me to come and share this information with you. If there are any questions about anything that I have talked about, I am more than happy to sit down and answer anything with you. Thank you very much.